guys, this is Lovin Meets with Dr. Wissam Ismail, an expert in breast cancer care. We spoke about prevention, early detection, and also the latest treatments of breast cancer and the youngest person he has seen with breast cancer. This is truly shocking and definitely worth a listen.
And so if you have missed it, don't forget to subscribe to the Lovin Meets podcast wherever you get your podcast from, and enjoy.
Hey guys, welcome back to the Lovin Dubai show in honor of Wear It Pink Awareness Day. We're joined by Dr. Wissam Ismail, who is an expert in breast cancer care. He'll be sharing important insights on prevention, early detection, and the latest treatments for breast cancer. Welcome to the show. Thank you so much for being here to discuss this important topic.
Thanks a lot, and thanks for inviting me.
Well, thank you for being here, of course. My first question is, what are the early signs that women can see or notice that can indicate breast cancer?
Very good question, and that's a very common thing, and people usually miss that. So I call them the 12 breast lemon, and I'll have a leaflet in my clinic and give it to patients. So basically, it's if there's any skin changes that you haven't noticed before, if there's any like a blood-stained nipple discharge, if there is a deep lump that you haven't seen before, or a lump under your armpit. So these are the main things that the patient tend to see, but sometimes they leave it alone and say, yeah, fine, well, it's around my period time, I'll leave it and then it'll get better. But this could be an early sign of breast cancer.
Interesting. When I think of personal detection for breast cancer, I just think of lumps and I think of nothing else. But you mentioned there are signs of skin changes and things. So are there any more subtle symptoms that we should be looking out for?
Yeah, so if these skin changes are not settling after a few weeks, everybody can have skin changes from irritation, a bit of an allergy. But if things are persisted over a few weeks, then that needs to be, get checked. And there's a medical term we call that peau d'orange. That's when the skin becomes very tense. And this is a sign that the breast cancer is just coming close to skin and this affecting, the lymphatics. And that's why, the skin becomes angry.
Mm-hmm. Now, of course, other than the symptoms that we can feel on our bodies, does breast cancer affect day-to-day life? That you go like, okay, fine, I have breast cancer, it's affecting my day-to-day life?
Not really. The important thing to know that breast cancer is the commonest cancer in the world now. So 1 in 8 ladies will have a breast cancer. It used to be like bowel cancer, lung cancer, but now breast cancer is just proceeding. And that's due to many factors. But to affect day-to-day life, it's not really affecting your life if we are detecting it early. So that's the key to it. Although it's the commonest cancer, but it's the most treatable cancer, and people can be cured from it very, very easily and quickly, providing that we find it early. Cure rate is over 99%. But if we found it very late, then that cure rate can drop to 60%, which is not great.
You mentioned there that the rates have increased due to certain factors. Like, what are those factors?
Well, it's multifactorial. Some of them are genetics, which is about 5 or 10%. Some of it's unhealthy lifestyle, smoking, stress, not sleeping early. And that's not only affecting breast cancer, but that's affecting all the cancers that, people can face every day. 1 in 3 people in their lifetime will have a cancer of some sort. But breast cancer in particular is very specific for the ladies who are not having a healthy lifestyle, very overweight, because the fat under the skin, can be transformed into estrogen. Estrogen is the main cause of the breast cancer that we see.
Interesting. Now, there's this misconception that breast cancer can really only reach women who are at a certain age. So if you can tell us what is the most common age for patients?
Well, that's very interesting, because let's say 15 years ago, the peak of breast cancer used to be between 40 and 50 years old. Now this is shifted by 10 years. So now we're seeing ladies having breast cancer, the peaking is between the 30 and 40 years, which is very scary and worrying. And that's why we encourage all the ladies to do your self-check. It's a 60-second a month. And this is my code always. So 1 minute a month to examine your breast at day 7 of your period, left side under your armpit, right side under your armpit. It takes a minute. If you do that, then, and if you see or feel any lump or anything that you're not used to, then yeah, go to a specialist. But regarding the age, there's a big shift, from the 40s to the 30s, and we're seeing very advanced breast cancer during that age period. And what's the reason behind that? Again, it's multifactorial.
Speaking of misconceptions, I think there might be so many. We grew up thinking, maybe using certain deodorants would cause breast cancer, maybe using certain perfumes. Is there any truth to that?
No, not really. There are multiple myths, I would say, about breast cancer. One of them is perfume, deodorant. The other myth is, oh yeah, I've got a lump and it's going to go away on its own, so I'm just going to leave it alone. No, it doesn't sometimes. And the other myth, I'm not going to get my breast checked because if I'm going to do a mammogram, that's radiation, that's going to cause cancer. No, it doesn't. The other myth is, I'm not going to do a biopsy because if it's cancer, then it's going to spread. And this is a very, very common misconception. And you always tell patients, listen, if it's a benign or it's a cancer, if you take a biopsy from it, it doesn't spread. It helps us to diagnose it early, it helps us to treat it early.
Trust your doctors, trust medicine.
I agree with Casey. We should trust our doctors more. Now, it is a genetic disease. However, if it does not run in the family, are women as well prone to, or maybe they're less prone? There's more of a low possibility to get breast cancer?
Yeah, well, people focus a lot on genetics, but the genetic related breast cancer is only about 10% of all the cancer that we see. And we have all the genetic tests to check for mutations. But if the ladies, they don't have any a genetic mutation, but they have a very strong family history of breast cancer, 2-3 relatives from the same side of the family get cancer, then yes, they are still, we categorize them as a low risk, intermediate, and high risk. So they're still going to be high risk, but it's not the genes that we know about. As much as we're advanced, but we don't know about all the genes, in there. We test about 21 genes for the genetic mapping, something that's related to breast cancer and thyroid cancer, pancreatic bowel cancer, but we still don't know about all the genes. So we tell the patient, yes, you don't have a genetic mutation that we can detect, but you're still a high risk. So you need to go for what we call enhanced monitoring, which means that you check yourself regularly. We check you every 6 months to 1 year with different modalities to detect any cancer early.
So detection is obviously super important, but what about prevention? Is that possible with breast cancer? Is there a way to lower my chances of getting it?
Yeah, it is. That's a very good question. So generally speaking, running a healthy lifestyle, that's very, very important. So sleep well, eat well, and by saying eat well, don't stop eating sugar, because a lot of people, I'm not going to eat sugar because it's going to cause cancer. That's again, it's a misconception. There's no direct link between sugar and cancer, but if your BMI is high, you're overweight, then you're not exercising, you're not having a lot of stress in life, then yes, this can translate into cancer at some point. But prevention is better than cure, as we always say. So if you're running a healthy lifestyle, you're doing your 60-second check a month, you doing your yearly checkup. And when you talk about screening, people have a bit of confusion about that, because screening is different than symptomatic. Screening, that's you go and get checked when you don't have symptoms. And that's utterly important, because if you start having symptoms, you've gone into a different category. You're changing a few millimeter cancer that we can detect without even me feeling it, to a 1 or 2 centimeter cancer that might gone to your lymph nodes, gone to your different organs, which is sometimes too late.
You just mentioned there that sugar may not have a direct link, but is there any type of foods or drinks that do have a direct link to cancer? For example, like alcohol, would that be known to cause breast cancer?
Yeah, well, high consumption of alcohol can cause different types of cancer, but not directly linked to breast cancer. But keeping in mind that consumption of alcohol on high amount, this is high calorie. So again, this can translate to a lot of calorie consumption per day, but again, not a direct link to breast cancer.
Mm-hmm.
Well, many women are concerned about their body images after they undergo treatment, which is very normal. So what are some ways that women can cope with that, with the changes?
Yeah, that's an excellent question. 20, 30 years ago, yes, ladies will thought about, okay, yeah, I've got breast cancer, we have to remove the breast. That's not, the case now. We have all the new technologies and techniques to preserve the breast. Only 20% of the surgeries that we do will lose the breast. That's because the cancer is widespread. Otherwise, 80% of our patients, they will keep the breast. We do, a different techniques to preserve the shape, the volume. They don't need to lose the breast. And even for worst case scenario, if we decide that the patient will go for mastectomy, get rid of the breast, then yeah, we can do an immediate reconstruction. So the I always tell them you will sleep with a breast and wake up with a better breast. That's a reconstructed, that's a younger version of your breast. You're not going to feel any difference in terms of the shape, in terms of the volume, especially for your family members, that kind of thing. So technology is really, really advanced, and we can use their own body tissue to reconstruct, or we can use a prosthesis.
I think it's amazing to hear that there's been so many advancements in the types of, surgeries and help after. But I think the party line is, as you said, if detected early, the majority of people can be cured from breast cancer.
Absolutely.
But what is something that we don't know about the treatment process? Because I'm sure that many women watching have been through it, and maybe it's not as easy as we say.
Yeah,
so is there any kind of challenges there that maybe someone who's just been recently diagnosed would need to be aware of?
Yeah, so the main challenge is what is the stage of the cancer that we detect. The earlier the detection, the less treatment that the patient will need. So for example, for a small early stage breast cancer, patient most of the time they don't need chemotherapy. They don't need a major surgery. So it will be like a matter of a small surgery, and then they'll have a bit of radiation, and then they might take like a hormonal treatment. But if the cancer is slightly more advanced, then yes, the patient may need chemotherapy. And I just want to focus a bit on the chemotherapy that people are really scared about. And I always tell them, okay, so chemotherapy had a very bad reputation, but it's a very, very good medicine. There's no generic chemotherapy anymore, but there's like a targeted therapy, there is immunotherapy that comes with the chemo regime. And we have like more than a third of the patients that start chemotherapy even before surgery. And the cancer vanishes even before we touch them with a knife. So that's a very, very revolutionary treatment, for the last 5 to 10 years. It wasn't there before, but now, we see, the cancer is cured, it's leaving the lymph node, it's not in the breast. So when I do my surgery, all what we see is just a bit of fibrosis tissue from the, successful treatment.
Interesting.
Now, lastly, how important is it to consider testing for breast cancer, and at what certain ages should women start testing for breast cancer?
So we recommend to start doing screening from the age of 40, and this is with mammogram. And if they see something on the mammogram, which is a breast X-ray, then they can go for ultrasound or different modalities. But that's not for the people who had a family history of breast cancer. So, for example, if a lady got a sister with breast cancer age 45, then she needs to start at the age of 35. So we go back 10 years to check them before. So yearly checkup according to the NCCN guidelines from the States, that's the most updated one. So from age of 40 up to the age of 75, 80. Doing the self-check is utterly important as well. I keep repeating this because it's very, very important. If you feel anything, don't ignore it. Don't sweep it under the carpet. No, get it checked. People don't, face their fears, but this is very important to acknowledge it, get it checked, because even if it's cancer, it's curable. 99%, you don't see many cancers with this cure rate. So this is a huge advancement in the treatment and in the cure rate. But the problem is, if you leave it, then no, it's a disaster.
Before you leave us, very quickly, what's the youngest case that you've seen of breast cancer?
23.
That should put the fire under us all to get our breast checked.
Definitely.
Okay.
Dr. Wissam, thank you so much for joining us. If people watching today have more questions than we were able to get through, how can they find you?
Well, I based at the American Hospital in Dubai, and they can reach us there. We're opening a new breast unit in Al Barsha Clinic, in the American Hospital clinics. By the end of the year, probably going to have like 4 breast units all across Dubai. So please, my only message is reach out. Don't ignore any breast symptoms. Do your 60 seconds a month and run a healthy life.
Thank you so much for your time this morning. Thank you, Farah.
Thank you, Casey.
And that leads us to the end of the show on this Friday morning. Have a fabulous weekend, and we'll see you back here on Monday morning. Bye-bye.